In this video, I'm going to share with you the 8 key things primary care doctors need to be doing to care for people with MS. Don't turn away, because that starts right now. Hey! Dun, 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 dun. Hey, howdy! Thanks for learning about MS with me, Boster. I started this YouTube channel to help my own MS clinic patients learn between visits, and it's my hope that through these videos, I can help you learn too. If you're impacted by MS and you want to up your game, please subscribe to the channel and ring that notifications bell so you don't miss any of my upcoming content. It takes a village to beat MS. Key village members include your family and close circle of friends. A key village member is your MS provider, and another key village member is your primary care provider. When I started my medical training, I had a hallucination that I would be the everything doctor for people impacted by MS. Quite honestly, that was really naive. I read every night, but only on one medical topic, multiple sclerosis. I can't keep up on the latest and greatest in endocrinology and cardiology and the vast array of things that we need to bring to the table to take care of a person as a whole. I need a medical partner, a primary care provider. In this video, I'm going to share with you the 8 things that I think PCPs need to do to help people impacted by MS. So let's jump in. Number 1, non-MS related medical issues. My mentor, Omar Khan, used to say, sometimes nature is too generous, and you can have MS and another medical problem. And there are a multitude of very common medical problems that are outside of the purview of the MS specialist. Things like controlling high cholesterol, high blood pressure, managing thyroid, managing prediabetes. These are all things that I rely upon a primary care provider to help with. That's number 1. Number 2, age-appropriate cancer screening. This is stuff outside of the nervous system, and it's super important. And I rely upon your primary care doctor to keep you up to date with colonoscopies, mammograms, pap smears, and dermatologic examinations. This is important stuff. And if you're only seeing your neurologist, you might be behind in these age-appropriate cancer screens. Keep in mind, if we can identify cancer early on a screen, oftentimes we can cut it out and cure it. Number 3, flu shots and vaccines. I've worked in a lot of different environments in neurology, and I've never seen a neurology clinic that stocks flu shots. I am delighted that I can send my patient to their primary care doctor to get their up-to-date flu shot or the pneumococcal vaccine or their varicella vaccine, etc. It's a great benefit to have a primary care doctor that can help with these things. Number 4, behavioral and lifestyle modifications. There are a lot of healthy living lifestyle things that the primary care doctor can help reinforce. For example, if you're a smoker and having trouble quitting, I would love to help you. Your primary care doctor is another awesome resource. If you have not yet embraced exercise as part of your lifestyle, that's an excellent conversation to have with your primary care doctor. Another example would be supplementation of low levels of vitamin D and having your vitamin D level checked. That's something your PCP can do when he or she's drawing standard laboratories. Number 5 is bone health. People impacted by MS over the age of 50 are at increased risk of osteopenia and osteoporosis. Those are doctor words for thinning bones. This is true in the setting of MS for both men and women, and it's independent from steroid use. The primary care doctor can order a DEXA bone scan, and if they identify that you have thinning bones, they can use medicines to help push calcium in the bones and strengthen them. Number 6 relates to MS disease-modifying therapies. The primary care doctor can help out here too. I think it's a best practice that the neurologist communicate with the primary care doctor and share the relevant laboratories and safety monitoring needed for a given disease-modifying therapy. Oftentimes, a person is seeing their primary care doctor more often than the neurologist, and it's an opportunity when you're in their office to get those labs drawn. Also, it's an excellent opportunity to reinforce adherence to disease-modifying therapy. If you're having trouble tolerating taking your DMT, you can talk to your MS neurologist, but you can also talk to your primary care doctor. Number 7 is a big one. Primary care doctors can really help out with managing symptoms. There are many symptoms that people impacted by MS might be exposed to at a higher incidence than the general population. Things like managing mood. Primary care doctors can assist with managing depression and anxiety, for example. A second important symptom is energy levels, and you can talk to your primary care doctor about the need for medicines like stimulants to assist and keep you awake so that you can be your best during the day. A third is dealing with deconditioning. The primary care doctor can prescribe physical therapy the same way that the neurologist can. Another example would be managing bladder urgency. The primary care doctor can assist in managing the bladder and even prescribing medicines to help. Number 8. The primary care doctor can assist when there's concern for an attack. Allow me to explain. If you have new neurological symptoms, we don't know yet whether it's a new MS attack or whether it's a pseudo-attack, which is most commonly triggered by a urinary tract infection, even an occult urinary tract infection, meaning one that you're not exactly aware of. It's oftentimes easy to stop by the primary care doctor's office and have a urinalysis. And if they identify that you in fact have a UTI, they can start antibiotics. This can be a super help in getting things started, as sometimes it's easier to get in to see the primary care doctor on the fly than it is to get into the MS neurologist. It takes a village to beat MS, and you need the villagers to be talking. Communication is key. The neurologist needs to send the primary care doctor a letter every time they see you, and I prefer if the primary care doctor sends me a letter. We also both have to be willing to pick up the phone and talk so that we can coordinate our care. That is a recipe to help you be the most awesome version of you despite having MS. Hey Village, do you have a primary care provider? And if so, how often do you see them? Please leave your answer down in the section below. I look forward to reading the comments. My name's Aaron Boster, and thank you for learning about MS with me. If you're impacted by MS and you want to up your game, check out this playlist right here. YouTube Analytics thinks that you would love this video right there, so check that one out. And if you haven't yet subscribed to my channel, please consider doing so. Just click that circle with my face on it. Go ahead, click my face. And until my next video or my next live stream or the next time I see you in clinic, this is Aaron Boster saying take care.